Good evening all. I am Narayanan. I am 73 years old. I have a family history of this prostate cancer. So I was keeping a close watch on my PSA. So last year by July I think, when I took the PSA it was around 13. So I was looking around for a good doctor who can take care of my problem. I was, quite a few people they suggested me Dr. Ananthakrishnan. So I came to him. So after a few tests he asked me to go in for a biopsy. So but the biopsy showed that it showed proved malignant. So he said it is, of course after the PET scan, he said it is totally localized, so why don't you go in for a operation so that it will be totally free from this. So last October 19th I got operated. So it's about 4 months now. Of course the post-operative as well as pre-operative care was very good in the hospital. Nothing to, no comparisons I would say. And after the operation, yes, that urine incontinence is still there. Of course I have been asked to go for this physiotherapy with this Jogo, which I have been attending for the last 5 weeks. Yeah, it is slightly I am feeling better, but maybe it will take some more time to get all right. Thank you. Thank you.
ഞാൻ ഡാനിയൽ 2018 எனக்கு இங்கே ப்ராஸ்டேட் கேன்சர் ஆப்ரேஷன் பண்ணியாச்சு, ரோபோட்டிக் ஆப்ரேஷன். அதுலேருந்து ஒரு 5-6 மாதம் ഞാൻ அந்த எக்ஸசைஸ் எல்லாம் பண்ணிட்டு இருந்துச்சு. பட் ஸ்டில் அந்த யூரின் போகிறதவளை கண்ட்ரோல் பண்ண முடியல. ஒரு நைட்டு ஒரு 4-5 வாட்டி போயிட்டு இருந்துச்சு. ஸோ ஒரு டைப்பர் தான் யூஸ் பண்ணிட்டு இருந்தேன், 4-5 டைப்பர் யூஸ் பண்ணிட்டு இருந்தேன் ஒரு நாளைக்கு. பட் இப்போ கொஞ்சம் கொஞ்சமாக இன்க்ரீஸ் பண்ணி அனந்தகிருஷ்ணன் சார் தான் எவ்ரி 3 months வந்து பார்த்துட்டே இருந்துச்சு. இப்போது கொஞ்சம் கொஞ்சமாக ரிகவர் ஆகுது. இப்போ அது இல்லாமல் இப்போ ஒரு பிசியோதெராப்பி வந்து பண்ணிகிட்ருக்கு, புதுசாக இங்கே வந்து ஆரம்பிச்சிருக்கு. அதிலே கொஞ்சம் பெட்டராக தெரியுது. இப்போ நான் நைட்டு ஒரு வாட்டி இல்லை 2 வாட்டி தான் போகுது. டைப்பர் ஒன்று, டே ஒன்று, நைட்டு ஒன்று, அவ்வளோ தான் யூஸ் பண்ணிகிட்ருக்கேன். ஐ ஃபீல் லிட்டில் பெட்டர். அன்றைக்கு அந்த ஆப்ரேஷன் பண்ணி ஒரு 5-6 மாதத்துக்கு கழித்து டெஸ்ட் பண்ணும்போது பிஎஸ்ஏ வந்து அந்த ஆப்ரேஷன் பண்ணி 3 மாதம் கழித்து டெஸ்ட் பண்ணும்போது 0.008 தான் இருந்துச்சு. ஸோ அது எவ்ரி 3 months கழித்து பண்ணும்போது அப்படி படிப்படியாக ஏறிட்டு இருந்துச்சு. இப்போ வந்து 3 வருஷம் ஆச்சு. PSA வந்து 0.251.
Good evening all. I am just 56 and I am Prakash. I had some issues in the prostate. There was a tumor and I got operated on December 28th. This is almost 2 months just getting over. The surgery went on well. The treatment and the support in the hospital was very good. I am in the path to recovery. I also want to understand from all of you your experience, and thank you for this.
Thank you, sir. Good afternoon to one and all present here today. We, on behalf of Indian Prostate Cancer Foundation, welcomes you to the IPCF support group meeting. This is our 15th support group meeting. All this while we have been having the physical meet as well as the virtual meet combined, put together everything. Today is the 15th support group meeting, and this is the first time we are having this hybrid meeting. So the speakers for today would be Dr. Arjun, consultant urologist, Curie Hospital, and Mr. Suresh Srinivasan, a volunteer of Indian Prostate Cancer Foundation. So before beginning the session, I would like to introduce another person who has joined us recently. So you all know Ms. Swaha, who have been there with us as a coordinator, IPCF coordinator. So now Mrs. Charu Smita.
Good afternoon to ladies and gentlemen present here. It's my pleasure to be a part of you all today. I would like to welcome the first speaker of the day, Dr. Arjun. So before that, I would like to give a brief introduction about who our Dr. Arjun is. So Dr. Arjun, he has done his MBBS, MS and MCH Urology. He has graduated from SRMC Porur, Chennai in the year 2011 and has completed MS the general surgery from PIMS Pondicherry in the year 2014 and was honored the Pondicherry University first rank in general surgery for the year 2014. He did his MCH in Urology from SRM Medical College, Katankulattur, Chennai, and finished his training in 2017. Then he joined as Senior Registrar in Urology at Savita Medical College, Chennai in 2017 and was promoted as Assistant Professor of Urology. After gaining 3 years experience in all general urology surgical procedures, he proceeded from the institution in 2020 to further specialization in urology. He had been trained in PCNL and urological ultrasound at Irvine, LA, USA during the hands-on training course for PCNL and ultrasound in urology, organized under American Urological Association in the year 2016. With interest in minimally invasive urology surgery, he attended hands-on training in dry lab laparoscopic urology training at Dubai 2016, animal lab training in laparoscopic urology in Thailand in 2017, and cadaveric laparoscopic urology training in Bengaluru 2018. In 2021, after completing 6 months fellowship in laparoscopic urology under Dr. George P. Abraham at Lakeshore Hospitals, Kochi, from January 2021 to June 2021, he joined Vatikutti Fellowship in Robotic Urology under Dr. Ananthakrishnan at Curie, Chennai in September 2021. His fields of interest and expertise are minimally invasive urological surgery, laparoscopic and robotic, percutaneous renal surgery, and retrograde intrarenal surgery. Today he is here with us to talk on male urinary incontinence. So let's all welcome him.
First of all, I would thank you all for taking such an effort to make sure that you're able to join us. So first of all, thanks for you all for joining us in the in-person meeting which we are conducting after quite some time because of COVID. So, and hearing from the feedbacks, we are able to get to know what is the long term, like what are the difficulties we are supposed to expect and what are the attentions what you are supposed to give. And the information a lot we are getting into, and definitely yes, we'll all try to work hard towards that aspect and we'll try to improve that perspectives. And so today, as we were talking earlier, in a topic one we'll be talking about urinary incontinence. Urinary incontinence is the most common problem post radical prostate when the people they're concerned or after surgery avangaloda experience to talk about will be the incontinence part. So when people who are going through it or who is still yet to recover completely out of it, avangalukku konja idea irukonu regarding the prostate, post prostatectomies and regarding urinary incontinence. So rough idea about incontinence and its treatment plan pathi I'm just trying to talk to you today. So first, urinary incontinence na enna? So that is the first நம்ம புரிஞ்சுக்க வேண்டிய விஷயம். இன்கான்டினன்ஸ்ங்கிறது நம்மளுக்கு தெரிஞ்சோ தெரியாமலோ யூரின் நம்மளை மீறி யூரின் வர்றது. தட் இஸ் வாட் பேசிக்லி யூரின் இன்கான்டினன்ஸுங்கிறது அர்த்தம். அண்ட் இதில் நிறைய டைப்ஸ் ஆஃப் இன்கான்டினன்ஸ் இருக்குது, காரணங்கள் நிறைய இருக்குது. பட் நம்ம மோஸ்ட் காமன் ரீசன் வாட் நம்ம குரூப்பை நம்ம என்கவுண்டர் பண்ணுறது வந்து போஸ்ட் ரேடிக்கல் சிஸ்டெக்டமி, அதாவது ரேடிக்கல் ப்ராஸ்டெக்டமி, அதாவது சர்ஜரிக்கு அப்புறம் வர்ற இன்கான்டினன்ஸ். அது ஏன் வருது, ஒய் டு வி ஹாவ் டு என்கவுண்டருங்கிறத புரிஞ்சுக்கிட்டோன்னா how we are supposed to manage it ங்கிறதுக்கு we'll have a better idea. So basically என்ன நடக்குது, what is the cause for it, ஏன் அது ப்ராப்ளம் most of us are facing it up, we'll just get to know about it. So as I said, urinary incontinence there are various factors that are related to it because they are based on the types, frequency, severity or effect of hygiene and quality of life. இதெல்லாமே plays an important role to the extent of the leak what we face, and the condition should be distinguished from sweating or from the urethral discharge. Sometimes நம்மளுக்கே அறியாம கொஞ்சம் the urethral discharges இருக்கும், அது கூட sometimes we might assume that is an urine leak. So on the differences, so we should be able to first figure out what is that what you are facing. Okay, and so first most common type of incontinence என்னன்னா stress incontinence. Stress incontinenceங்கிறது என்னன்னா நம்ம தும்பும் போதோ இரும்பும் போதோ அந்த டயத்தில் வில் see some drop of urine coming out without our awareness. இதுக்கு பேர் தான் ஸ்ட்ரெஸ் இன்கான்டினன்ஸுங்கிறது. This is one of the most important component of stress incontinence after radical prostatectomy கூட நிறைய பேருக்கு this kind of incontinence தான் காமனாக இருக்கும். இதுக்கு காரணங்கள் என்னன்னு பார்த்தோம்னா ரெண்டு. The pelvic floor muscles ன்னு சொல்லும்போது the muscle வந்து it will become weak following the surgery. So அந்த muscle weak ஆகும்போதும் following the surgery the sphincter ன்னு சொல்லுவாங்க. I'll just talk to you what is sphincter also. அது weak ஆகிறதுனால we are having a little bit of incontinence. So போஸ்ட் ஆப்ரேட்டிவாக நம்ம மேனேஜ் பண்ண வேண்டியது ரெண்டு விஷயங்கள். ஒன்று பெல்விக் ஃப்ளோர் ஸ்ட்ரென்த்தான் ஆகணும். செகண்ட் ஸ்பிங்க்டர் ஷுட் பிகம் வீக்கான ஸ்பிங்க்டர் ஷுட் பிகம் ஸ்ட்ராங்கர். அதனால் we can control the continence part. ஸோ அதர் டைப் ஆஃப் இன்கான்டினன்ஸ் வந்து urge incontinence. urge incontinence என்னென்னா நமக்கு யூரின் வரும்போது till we reach the restroom நம்மளால் யூரின் கண்ட்ரோல் பண்ண முடியல. You will be aware you are passing urine but you will not be able to control it to an efficient time until you reach the destined spot to pass the urine. This is called as urge incontinence. So basic thing enna theriyumna, this is where the prostate is. So ella surgeries what we are targeting will be this part of the prostate. That is we have the bladder, adu keela irukkiradhu prostate, and what you see below that is the urethra. Adu moolama namakku urine velila varradhu. So this part of the prostate தான் நமக்கு வந்து base and this is the apex. So in the segment of the prostate is getting completely removed. So males எல்லாத்துக்குமே there are ரெண்டு part in the continence mechanism. One we call as a internal sphincters. அதாவது இது நம்ம கண்ட்ரோலில் இல்லை, இட்ஸ் நம்மளோட brain controls the part of the it's an involuntary controlled sphincters. அண்ட் இதை தவிர வாலண்டரி ஸ்பிங்க்டர், அதாவது நம்மளா தோணும் போது நம்ம யூரின் போகிறது கண்ட்ரோல் வச்சுக்கிறதுக்கு there's another sphincter that is called as external sphincters. அந்த ஸ்பிங்க்டர் வந்து பேஸ் ஆஃப் த ப்ராஸ்டேட்டில் இருக்குது. So when you go for the prostate surgeries, both the part of the sphincters are getting involved. And third thing is the pelvic floor muscles. Then the muscles helps in keeping the urethra tight. அதனால நமக்கு வந்து urine leak ஆகாமல் இருக்கும். So this is the basic thing what happens for the incontinence purpose. So அதான் various part of the muscles, musculatures and what helps in causing the continence purpose. So what happens in post prostatectomy? So post prostatectomy பார்க்கும்போது நம்ம மூணு பார்ட் அதில் கன்சிடர் பண்ணணும். ஒன்று ஸ்பிங்க்டரே வீக்காக இருக்கிறதுனால யூரின் பாஸ் பண்ணுறது, நம்ம கண்ட்ரோல் விட்டு போகிறது ஒன்று. செகண்ட் திங் வந்து சம்டைம் இட் கேன் பி பிகாஸ் ஆஃப் பிளாடர் வந்து புஷ் பண்ணுற டெண்டன்சி கொஞ்சம் வீக்காக இருந்துச்சு as பிகாஸ் ஆஃப் ஏஜ், டயபெட்டிக் ஃபேக்டர்ஸ் இருந்துச்சுன்னா கூட there can be associated urine leak. ஸோ பியூர்லி யூரின் கான்டினன்ஸ் வந்து ஸ்பிங்க்டர்னால் மட்டும் இல்லாமல் பார்ட் ஆஃப் பிளாடரோட ரோலும் இருக்கலாம் for the incontinence part. Next one. So sometimes what can be this an obstruction, அதாவது யூரின் போகிறது கம்ப்ளீட்டாக அடைச்சிச்சு. That can happen in non-prostate surgery. வேறு causes for the prostate surgery like BPH, TORP பண்ணாங்க, அந்த மாதிரி சர்ஜரிஸ் பண்ணால் அந்த மாதிரிக்குள்ள ரீசன்ஸ் we can expect, லைக் மீதி இருக்கிற ப்ராஸ்டேட் கிளாண்டோ இல்லாட்டி ஆப்ரேட் பண்ண இடத்துல வர சுருக்கமோ அதனால யூரின் போகிறதுக்கு சிரமங்கள் இருக்கலாம். ஸோ these are various causes. அண்ட் பிளாடர் டிஸ்ஃபங்க்ஷன் என்ன, யூரின் சுருங்குற தன்மை வீக்காகுது. ஸோ அது ஒன் ஆஃப் த ரீசன்ஸ். ரெண்டாவது ரீசன் என்ன இருக்கலாம், அந்த கண்ட்ராக்டிலிட்டியை தவிர நம்ம வந்து இர்ரெகுலர் கண்ட்ராக்ஷன்ஸ் இருந்துச்சுன்னா யூரின் வெளியில் போகாது. ஸோ தெர் ஆர் வேரியஸ் ரீசன்ஸ் லைக் திஸ் விச் இஸ் காசிங் இட். ஸோ அண்ட் மூணாவது ஸ்பிங்க்டர் டிஸ்ஃபங்க்ஷன். திஸ் இஸ் மோஸ்ட் ஒன் ஆஃப் த காமன் திங் வாட் ஹேப்பன்ஸ் போஸ்ட் ரேடிக்கல் ப்ராஸ்டேட். ஏன்னா சர்ஜரி பண்ணதுக்கப்புறம் அந்த ப்ராஸ்டேட் எடுக்கிறது க்ளோஸ்னஸ் டு த ஸ்பிங்க்டர் வந்து ரொம்ப அதிகங்கிறதுனால weakness of the sphincter is the most common reason what we come across in post radical prostatectomies. And so எப்படி இதை மேனேஜ் பண்ணலாம், how do you manage the incontinence? So I think ரஃபாக ஓரளவுக்கு ஐடியா கிடச்சிருக்கும் what is the cause for the incontinence சொல்லிட்டு. So let's look into the management part. எப்படி இதை மேனேஜ் பண்ணலாம், அது மேனேஜ் பண்ணுறதுக்கு we have different lines of management, there are multiple approaches to manage it. So எப்படி categorize பண்ணலாம்னா, one is the behavioral management. Behavior in the sense like how do we improve the means of exercises, how does exercise help us and how do we do the exercise, இதெல்லாம் வச்சு ஒரு பார்ட் ஆஃப் கான்டினன்ஸ் வரலாம். Then the second sector of people comes to the medication. Medication எதுக்காக மெயின்லினா, ஸோ நம்ம அசோசியேட்டில் பிளாடரில் ஏதாவது ஒரு இஷ்யூ இருக்குது அதனால லீக் இருந்துச்சுன்னா, இல்லாட்டி something to make sure that your urine flow is better, improvement பண்ணால் that might reduce a part of the incontinence. So that way it helps in medication. Both behavioral and medications which is still complete continence varadukku, we finally have options for the surgical options for continence also. So let's have a little bit of look into it. So first, dietary adjustments. So we should know what diet triggers that kind of an incontinence feel. Basically because it will call us bladder oda contractility அதிகப்படுத்துறது. Some kind of diet it causes it. NMI diet, alcohols, or sometimes like peaches, pineapples, artificial sweetness, other nama saapdra fruity or other aerated drinks, karam sapad like spicy diets, and coffee and tea. These things will have that bladder vandu, it will cause more irregular contractility, it will cause an hyperactivity of bladder. Adu bladder oda contractility adhigapaduttum. So adanal kuda some part of incontinence irukkalam. So first we have to titrate our dietary parameters. So we will make corrections in the diet so that in the part of the thing resulting in the incontinence first control pandrathu. So if you have controlled all this, still we have it abdina, next we go in for something called as bladder training. Bladder training is enna, we have to bring back the routine. Adha nama routine eppadi nama bladder nama vandu urine void பண்ணுவோமோ, we should remember it to us again ourselves. So adukku select training processes நம்ம பண்ணணும். Like யூரின் போகிறதா, நம்ம வர்ற யூரினை ரெஸ்ட் ரூம் போகிற வரைக்கும் நான் கண்ட்ரோல் பண்ணிட்டு தான் யூரின் போகணும், என்ன ஏர்ஜ் இருந்தாலும் சரி. ஸோ தேட் வே யூ வில் ஸ்டார்ட் contracting your sphincters and your muscles, which will start improving your control for the urine rhythm. So that is one way of doing it. Second thing is like pelvic floor exercise, and this is what we advise for all patients post-operative. This is the basic pillar behind continence varradhukku following the procedure. That is the pelvic floor exercises. More than 88% to 90% of people will get back their confidence with 3 months of time. That is how many studies have also proven to us like in past. So sometimes this exercise will not be helpful in post-TORP, but radical prostatectomy, yes, more than 88% of people will have a good benefit out of it. So Kegel's exercise FD NMI start panna. I think everyone would have been knowing it earlier. I'm just brushing it through so that நம்ம எல்லாத்துக்கும் திருப்பி remember பண்ணிக்கலாம். It will help us also. So when we start a Kegel exercise, first what we have to remember na, bladder empty பண்ணிக்கணும். Before we start the Kegel exercise, we pass out the urine and then we start with the Kegel's exercise. And Kegel exercise basically is to ரெண்டு விஷயத்தை டார்கெட் பண்ணுறது. ஒன்று வந்து the muscle of the pelvic floor strength improve பண்ணணும். So we have to keep contracting it and relaxing it. So அது ரெண்டாவது. And எவ்வளோ ஃப்ரீக்வன்சியில் பண்ணணும்? மினிமம் 10 times once in solely, at least 10 to 15 times per day. So roughly it will make 150 times. But many places, many studies have shown that more the time we do it, the better the tone of the muscle improves. So averagely 250 to 300 times is a very good option what we could do. That is the maximum what anyone nala panna mudinja attempts. So definitely that's a good option we have to try. And it was initially started in 1936. They first started describing about the pelvic floor muscle exercises, and over years they have found it has been nalla results irukku. So later they have come up with more of advancements in pelvic floor other than inga paakra jogo and other things. It is all visual feedback comparison. So the first step is to properly identify the pelvic floor muscles, and pelvic floor muscle நம்ம கண்ட்ராக்ட் பண்ணும்போது அப்டமன் ப்ரெஷர் அதில் வந்து பார்ட் இருக்கக்கூடாது. தட் இஸ் வாட் மேக்ஸ் அ மோஸ்ட் இம்பார்ட்டன்ட் திங் இன் த பெல்விக் ஃப்ளோர் எக்ஸசைசஸ். ஏன்னா பெல்விக் ஃப்ளோர் ஸ்ட்ரென்த் பண்ணும்போது த அப்டாமினல் காம்பனன்ட் ஷுட் பி ஆஸ் மினிமல் அஸ் பாசிபிள். எவ்வளோ குறைய அப்டாமினல் ப்ரெஷர் யூஸ் பண்ணுறோமோ அவ்வளோ அளவுக்கு நம்ம பெல்விக் ஃப்ளோரோட மசில் டோன் இம்ப்ரூவ் ஆகும். தட் கிவ்ஸ் அ ஃபாஸ்டர் ரெக்கவரி ஃபார் அஸ். பண்ணும்போது வில் நாட் பி ஏபிள் டு இனிஷியலி டிஃப்ரென்ஷியேட் பண்ண முடியாது. அப்டாமன் யூஸ் பண்ணுறோமா பெல்விக் மசில் யூஸ் பண்ணுறோமா நம்மளுக்கு அந்த டிஃப்ரென்சஸ் தெரியாது. பட் நம்ம கான்ஷியஸ்னஸோட பண்ண ஆஃப்டர் பீரியட் ஆஃப் டைம் வீல் அண்டர்ஸ்டாண்ட் தட் நம்ம அப்டமனை யூஸ் பண்ணாமல் பெல்விக் ஃப்ளோர் மசில்ஸை மட்டும் யூஸ் பண்ணது வி கெட் டியூன் வித் இட். அண்ட் ஒன்ஸ் வி அது பழகினதுக்கப்புறம் தட் வில் கிவ் த மோஸ்ட் எஃபெக்டிவ் ரிசல்ட்ஸ் கம்பேர் டு ரெகுலர் Kegel's exercise how we do without the awareness. அதாவது நம்ம அப்டமன் மசில் யூஸ் பண்ணுறோமா இல்லையாங்கிறது வச்சு பார்க்கும்போது. ஸோ யூசேஜ் ஆஃப் பெல்விக் ஃப்ளோர் மசில் alone is what is going to help us more compared to usage along with the abdominal muscles. So next. So daily pelvic floor muscle exercise, and the purpose of the daily exercise is to increase the muscle strength. That muscle oda strength improve agano. Second thing is like motor skills. Like nama contract pannonu nenaikumbodu the response to the contraction, it should be equally faster. So on the response varadukkaga we keep continuing the pelvic floor exercise, and that is what is going to give us the most benefit of it. So generally they say the 45 to 50 exercises per day, but tone to improve we need the more number of times, so that will give more even better results. And patients generally find it easiest to practice the exercise in a lying position. Adu padutittu pandrathu you feel more easier compared to in a sitting and position. There are various positions where you can go for the Kegel's exercise. I'll show a couple of positions which are ideal, which can be easier for you to get it done. So there's another type of incontinence that is called as an urge incontinence, and urge incontinence is the same way it's to be managed. The ideology behind it is like controlling the urine with our knowledge before we reach the restroom. Idana our target for the exercise. When you start practicing it, the faster your continence comes back. Another thing what of late something called as biofeedback. Some people they come after 3 months college, still I have a little bit of incontinence part, one pad usage or 1.5 pad usage. I heard a couple of people know 1.5 pad use so under my situations, if you regular exercise when we feel that our continence has not completely come back, that is where the biofeedback comes. Biofeedback na, are we doing the exercise correct? Monitoring. As I said, yes sir. Sure sir, please. Okay sir.
But I am not able to leak it control.
Eவ்வளவு packs support
One.
It's completely wet ஆகுதுங்களா இல்லாட்டி some drips of urine அந்த மாதிரி இருக்குங்களா?
காலையில வந்து நைட் வரைக்கும்.
So first you have to see what kind of leak அது உங்களுக்கு urgency உங்களுக்கு urgently urine வந்துட்டு அந்த சமயத்துல வருதா எந்திச்சு நடக்கும்போதே உங்களுக்கு தெரியாம 2-3 சொட்டு வருது இருமும்போது so okay. So what we can target on the pointless sir, next time you cough when you are able to realize it first, that's what I told you earlier also, we try to contract the muscle first before we cough it out. That comes with a little over time because that is this is called as quick reflex. அதாவது என்னன்னா நம்மளோட quick reflex component வந்து இல்லாதப்போ தான் இந்த மாதிரி லீக் இருக்கும். ஓகே நீங்க ஜோஹோ போகும்போது உங்களுக்கு அந்த குயிக் அண்ட் இது சொல்லி கொடுத்தாங்க இல்லையா குயிக் அந்த குயிக் பார்ட் யூ ஆர் டூயிங் இட் அஸ் அன் எக்ஸசைஸ் ஏன்னா பிகாஸ் தட் குயிக் ட்விச் இஸ் வாட் இஸ் கோனா ஹெல்ப் அஸ் மோர் exercise also. Okay. So what we can do is like the quick twitch component if you do more and more frequently, that is what is going to gain control. In the final bit of completion will take some time. So there are other means that I'll again tell you, but these are all like other invasive measures. Invasive illama the best result what we could attain we are targeting is what through the pelvic floor exercise. Adanala I've been telling about more about the pelvic floor before I went into the other options what we have. And the options are there. I'll just come back to you what are other options we do have. I'll just give a limelight for it. But more efficient thing is an exercise is what we can target. So what is biofeedback? Biofeedback na enna na nama pandradha nama kannala paakradhu. So few electrodes வந்து நம்ம attach பண்ணிட்டு we'll ask you to contract the muscle. நம்ம muscle contract பண்ணும்போது efficient contract ஆகுதா? Second thing வந்து அந்த muscle-க்கு அந்த strength இருக்கா contract ஆகுதுக்குன்னு அந்த wave pattern வச்சு பார்க்கலாம். Example first wave pattern பாத்தீங்கன்னா curve வந்து flat-ஆ இருக்குது. Second wave pattern பாத்தீங்கன்னா you can see some mountain peaks பார்க்க முடியுது. So this is how a normal biofeedback-ல இருக்க வேண்டியது. That is when you contract muscle strength இருந்துச்சுன்னா you'll be able to see the peaks. And once you relax the peaks start coming down. Whereas அந்த மாதிரி இருந்துச்சு when you try to do it now your muscle is weak. So you have to more target to increase the muscle tone and the strength. So this is what is called as a visual feedback. இதுக்கு பேர் தான் biofeedback. So when we see we understand. So when we understand நம்ம அது என்ன டார்கெட் பண்ணுமோ அந்த நெசசிட்டிக்குள்ள மெஷர்ஸ் நம்ம டார்கெட் பண்ண வேண்டியிருக்கும். So this is what biofeedback is about. So as I said, this is another demonstration. We have video monitoring also. Video monitoring which you can look at the curves to understand what is it like. And there are some drug agents, something called as anticholinergic. When we said as in a few drops of urine varas, some bladder associated components like bladder irregular contractions. I already saw my component my few drops of blood like urine varala. So we have some options of drugs. This is a trial medication, we can try giving it, but unless and until we'll exactly know on the bladder or component we'll have better results out of it. So there are various drugs like this which has to be continued for a few weeks time to understand the difference and the outcome. How is it like before and how is it after? Is it helping a lot? So this is one of the options what we can consider following the exercises. And second thing is surgery. Surgery for the main reasons what we consider. Other than the exercises very bothersome incontinence like the frequency of incontinence or unexpected we are not feeling very comfortable about it. அந்த மாதிரி இருந்தாலும் இல்லாட்டி persistent usage of more than 5 or 6 diapers per day for being continuously for more than 1 year to 1.5 years. So, but slow improvement in that we can wait and watch, but still improvement it's the same diapers use பண்ற மாதிரி இருக்கு, then that time it can be considered as an option. Or in spite of the frequent exercises, the frequency of diaper குறையல, still it is the same 5 or 7 diapers அப்படியே இருக்கு. இந்த மாதிரி options தான், then surgery can be considered as an option for the treatment. So surgeons வந்து one minimally invasive option is called as injectables. Injectables என்னன்னா we inject some kind of material in the intramural part, urethra க்கு நடுவுல we will inject the some materials into it. So what will happen is when you raise it, urethra ல prostate இருந்த மாதிரி it will create two kind of bulges. So அது வந்து occlude பண்றதுனால urine leak வந்து நமக்கு significantly reduce ஆகும். But normal voiding what you do, it will be there. The urge incontinence part உங்களுக்கு அறியாம urine போறதோ, those things will significantly reduce down. But only most important thing is like it will require repeated procedures, like depending on the material what we use, they might require repeated procedures. It's not a definitive complete procedure, like curative procedure kadiyadu. It's like as and when required we have to keep doing it. And what are the indications? In a minimum 3 pads irukku, or different centers have a different protocol. Some people say 3, some people say 6. So less than that, the main thing is like there should not be any radiation to be given. Post radiation kit is not a very good option for that. And patient should be okay with the multiple sittings. And repeated procedures they occur. Second thing, earlier what people were doing was something called a slings procedure. Sling procedures na we do one surgery or a mesh madriyo or loop madriyo vachu we'll try to give an extra compression from the outside of the urethra. இது வந்து யூரித்ராக்கு நடுவில் கொடுத்து நம்ம இன்ஃப்ளேட் பண்ணி பண்ணுற மாதிரி யூரித்ராக்கு வெளியில் வச்சு யூ கேன் கிவ் அ கம்ப்ரெஷன். ஸோ திஸ் சப்போர்ட் வில் ஆக்ட் ஆஸ் அன் கான்டினென்ட் ஃபீச்சர் ஃபார் அஸ். ஸோ அந்த கம்ப்ரெஷன் இருக்கும்போது whenever you void, the pressure will be equivalent and sufficient so that when you void the mesh relaxes. And normal டயத்தில் இருக்கும்போது it will tighten it up. So that way it helps you in reducing the leak. So இது இன்னொரு way of action what we could take into consideration. And off late and most gold standard what people are now telling is something called as artificial sphincters. Artificial sphincters na enna, we keep a sphincter madri, as I said sphincter, urethra irukku, urethra thodi sphincter irukku, we saw the anatomy. So adhe madri we'll keep an artificial kind of an or cuff onu vechiruvanga. So in the cuff ku we'll have a separate balloon madri onu kuduthiranga. So when you want to void urine, you can loosen it. When you want, you can tighten it up. So that way it will help it as a corner. This is more intense leak irukavanga, that is a more beneficial option. I'll just show a couple of images for it. And here you can see, I think we have something called as a control pump. Idan cuff around the urethra, and the cuff on the inflate பண்றதுக்கு the water வந்து bladder பக்கத்துல வச்சிருக்கோம். So whenever we press the cuff, the water gets displaced, goes into the cuff and it tightens up the cuff. So whenever you want to urinate, we have a separate button for it, so it will release it and you can pass. So you know the severe incontinence status level patients, this might be helpful. But minimal leak exercise still again is considered as the best option what we have of current trends. Conclusion, urinary incontinence is a temporary problem. Proper attention for the pelvic floor exercise is the proper exercise being done in the right way, the best results can be attained. And there are various modifications like lifestyle from the dietary habits, surgical options, there are complete variety of options we have. But as in time when comes by, necessary option has to be chosen at the right point of time. So from there on we'll just try to understand our own physiology. Namalke purinju nam body every mechanism purinjittu, then we will try to figure out what is the option we have to consider. Thank you, sir.
Sir has given a very nice talk about incontinence. You see now. So you have a big spectrum in this incontinence. So some people after surgery will have 5 or 6 pads, and that will last for a long time. Some people will rapidly come down to normal levels and maybe use 1 pad for 24 hours or 1 pad for 48 hours on the level. So most of these interventions that you saw other than the pelvic floor muscle exercises are for significant levels of incontinence, like minimum 2 pads lasting for more than 1 year, then we can try and intervene. one pad in 24 hours must exercise is the best. And because all of the other interventions are invasive, like sir said, it's invasive intervention. So effort reward ratio pathina adla varadu. So for what invasion that you're doing to the system, are we getting enough benefit in pathina varadu? So with the muscle exercises, if it's not coming for, இப்போ சார் சொன்னார் இல்லையா, எனக்கு நடக்கும்போது வரவே இல்லை அப்படின்னு. So it's, which means when you're walking there is no incontinence, but when you're lifting weights or you're getting up, there is some incontinence. He says he is using one pad for 24 hours. Yeah, that is a typical example of a situation where we will not intervene. We will never go and do any surgery for that or any those fillers for that or anything particular. So that is something that has to be managed with the muscle toning, strengthening type of exercises. That's the best. So any intervention for incontinence should only be done in a significant level of incontinence, not for these small things of unwavering. So that's something that I wanted to add to what you said. So he's given examples of sphincters, fillers and all that. That is significant incontinence. Not so when you stratify them, this is minuscule, mild, moderate, severe incontinence. Severe incontinence, of course. Moderate incontinence, definitely. Even mild. So one pad in 24 or 48 hours, ரொம்ப கம்மி. Not a problem. Okay? Anything else? Questions about incontinence? We're happy to answer. Ramsam sir, உங்களுக்கு எப்படி இருந்தது? When you started, how was it? What was it? I think you are one of the...
When started after the operation, it was six times I was using. Then I started doing the exercise, started reducing 5, 4, 3, 2, 1, 0.
Okay. So he is one of our senior most patients here. Who underwent
2.5 to 3 months it took.
Very good. And
for me also within 2 to 3 months I stopped using.
உங்களுக்கு எப்படி? You're not using. When did you start? எப்போ நீங்க எப்போ உங்க சர்ஜரி எப்போ?
2 months 11.
November 2021 was your surgery. Now you're not using any. So how long have you not been using pads?
Regularly
No. When did you stop using pads?
After 1 month.
1 month after surgery, it completely stopped. So, but are you still doing the exercises?
Yes.
Very good. So just because you stop the pad usage doesn't mean you should stop the exercises.
Exercise I'm doing.
Exercises are important. So you see, in terms of so it's only ரொம்ப simple. Some people have grasped how exactly to do that exercise, and it's completely stopped. Kudusami sir, உங்களுக்கு எப்படி இருக்குது? How was it?
ரொம்ப rare I have the problems.
ரொம்ப rare
மார்னிங்கில் எடுத்துச்சதும் ஒரு தடவை போனோம்னா மறுபடியும் கொஞ்ச நேரம் போய் அந்த யூரின் ட்ராப்ஸு ஸ்மால் குவான்டிட்டி போகும். டே டைப்பில் இருக்கிறது இல்லை.
ஓகே.
ஐம் ஆல்ரைட். நான் பேடு வந்து ஒரு 1.5 மாதமாக நான் யூஸ் பண்ணேன் சர்ஜரிக்கு அப்புறம்.
After that, no pads. See, this 1 drop into the underwear, 2 drops into the underwear, எல்லாம் கவலைப்படாது. So that's அது பாதி பேருக்கு நடக்கலாம். You understand? Even after you pass urine and come out, some drops you will feel in the underwear. So I wouldn't worry about those sort of things. Suppose you are using 2 or 3 per day, and throughout the day you are using it. That's something that we need to actively sort out and do some sphincter or something like that. So in fact, less than 1% of patients will have that. So actual intervention for incontinence and bathroom are very rare for us. Who else is speaking?
Sometimes
I still do the exercise.
நீங்க பண்றீங்க? Model patients sir.
sometimes irritation is there. Very rare.
அதுக்கு we need to look at the cause. Urine culture ல மட்டும்.
So thank you so much, Dr. Arjun, for sharing your valuable knowledge with all of us. And thanks a lot to Dr. Ananthakrishnan sir also for pitching in and adding so much value to the talk. So என்னோட எண்ட்லேருந்தே விச் இஸ் சம்திங் நாட் தேர் இன் தி ஸ்பீச், பட் எனக்கு ஆன் தி ஸ்பாட் எனக்கு ஷேர் பண்ணணும்னு தோணின ஒரு விஷயத்த ஐ வாண்ட் டு ஷேர். பேசிக்லி வந்து இது இட்ஸ் லைக் என்ன சொல்கிறது, நம்ம இந்தியாவில் நம்ம கலாச்சாரத்தில் வந்து இது வந்து ரொம்ப ஒரு ஷை டாபிக். இதெல்லாம் பற்றி யாராவது பேசுவாங்களா அப்படின்ற ஒரு ஷைனஸ் வந்து இன்னும் இருக்குது எங்கேயோ, சம்வேர் இட் எக்ஸிஸ்ட்ஸ். வயசானவங்களுக்கும் சரி அண்ட் சின்னவங்களுக்கும் கேட்கவே வேண்டாம். என்ன நினைப்பாங்களோ ஏது நினைப்பாங்களோ எப்படி கை காலோ அதே மாதிரி தான் இதுவும். இட்ஸ் ஜஸ்ட் அனதர் பார்ட் ஆஃப் த பாடி. எப்படி வி ஆர் மேட் ஆஃப் மசில்ஸ், அதுவும் இட் இஸ் மேட் அப் ஆஃப் மசில்ஸ். அவ்வளோதானே தவிர இதில் வந்து வெக்கப்படுறதுக்கோ சஞ்சலப்படுறதுக்கோ எதுவுமே கிடையாது. திஸ் ஒன் திங் ஐ வாண்டட் டு டெல். அண்ட் அனதர் திங் விச் ஐ வாண்டட் டு டெல் வாஸ், உங்கள் எல்லாருக்குமே உங்கள் ஏஜ் குரூப்பில் வந்து ஃப்ரெண்ட்ஸ் இருப்பாங்க, ரிலேட்டிவ்ஸ் இருப்பாங்க. ஸோ நான் என்னோட பர்சனல் ரிக்வெஸ்ட் என்னென்னா, ப்ளீஸ் when you share, you can share your problems with them and அவங்க வந்து you can talk about this to them. ஏன்னா நிறைய பேருக்கு வந்து அவங்களா ஓப்பன் அப் ஒரு விஷயத்தை பண்ணுறதுக்கு they'll feel shy. பட் நீங்கள் உங்கள் எக்ஸ்பீரியன்ஸை ஷேர் பண்ணும்போது அந்த இடத்துல ஏற்கனவே இந்த மாதிரி ஒரு விஷயம் இருக்கலாம், இல்லை வேறு யார்கிட்டையாவது they will refer to their friends. ஸோ இப்போ ரொம்ப இம்பார்ட்டண்ட்டான விஷயம் என்னென்னா, நம்ம இதை பற்றி பேசணும், இதை பற்றி ஒரு அவேர்னஸ் கொண்டு வரணும். எப்படி எய்ட்ஸ் வந்து ஒரு டஸ்ட்பின்குள்ளேயே கடந்துச்சு, பட் இன்னைக்கு எய்ட்ஸோட அவேர்னஸ் பாருங்கள் எங்கே இருக்குன்னு. ஸோ இட் ஹஸ் ரீச்ட் ஈச் அண்ட் எவ்ரி ஸ்மால் வில்லேஜ். ஒன்றுமே ஒரு இங்கிலீஷ் தெரியாதவாளாக இருக்கட்டும், படிக்காதவங்களாக இருக்கட்டும், எல்லாருக்குமே அந்த இன்ஃபர்மேஷன் இருக்குது. ஸோ ப்ரோஸ்டேட்டுங்கிறது த வே ஆஃப் யூரினேஷன் இது எல்லாமே வந்து இட் இஸ் வெரி ஒரு நார்மல் ரொட்டீனில் இருக்கிற ஒரு விஷயம். இதை பற்றி வெக்கப்படுறதுக்கு எதுவும் இல்லை. எல்லாரும் இதை பற்றி பேசணும், உங்கள் ஃப்ரெண்ட்ஸ் கிட்ட பேசணும். அண்ட் அவங்களுக்கு ப்ராப்ளம் இருந்தால் ப்ளீஸ் ரெஃபர் டாக்டர், குட் டாக்டர். அண்ட் உங்களுக்கே தெரியும், டைமுக்கு பண்ணினா இட் இஸ் ரொம்ப ஈஸியாக முடியக்கூடிய ஒரு விஷயம். இதை நம்ம வந்து வெக்கப்பட்டுட்டு இழுத்துட்டே போனோம்னா இது எங்கே போய் எப்படி முடியும்னு நம்மளுக்கு தெரியாது. ஸோ நம்மளுக்கே தெரியாமல் நிறைய பேரை நம்ம சேவ் பண்ணலாம், ஜஸ்ட் பை மீன்ஸ் ஆஃப் அ லிட்டில் பிட் ஆஃப் அட்வைஸ் அண்ட் லிட்டில் பிட் ஆஃப் எக்ஸசைஸ் நாலேஜ் ஃப்ரம் த ரைட் டாக்டர் இன் த ரைட் டைம். ஸோ சூரிய நமஸ்காரம் கரெக்ட் டைத்தில் பண்ணணும். மேக் ஹே வைல் த சன் ஷைன்ஸ். அவ்வளோதான். இதுக்கு மேலே ஐ டோன்ட் வாண்ட் டு போ யூ ஆல். நான் சொல்ல வந்தது உங்களுக்கு புரிஞ்சிருக்கும்னு நினைக்கிறேன். ஸோ தேங்க்ஸ் அ லாட் ஃபார் ஹியரிங் மீ. அண்ட் now let's now talk about the next speaker. So we would welcome the second speaker of the day and ஒரு brief information அவரை பற்றியும் let us share. So Mr. Suresh Srinivasan, அவர் வந்து he is from Delhi. He got connected with the IPCF support group, an NGO dealing with prostate cancer. அவர் ஆக்சுவலாக என்ன பண்ணணும்னு நினச்சார்னா, he wanted to, இப்போ நான் உங்களுக்கு சொன்னேன் இல்லையா, he wanted to volunteer, நிறைய அவேர்னஸ் க்ரியேட் பண்ணணுன்றது ஒரு நோக்கம் அவருக்கு. அண்ட் இதுக்கு என்ன ரீசன் அப்படின்னா, அவரோட அப்பா he fought prostate cancer and it is a general thing. அதை அனுபவிக்கிறவங்கள விட அனுபவிக்கிறத பார்க்குறவங்களுக்கு எவ்வளோ பாதிப்பு இருக்குங்கிறது நம்ம எல்லாருக்குமே தெரியும். ஸோ ஆஸ் அ சன் he saw his father fight through it and he wanted to become a volunteer and he was very passionate. And அவரோட மெயின் இது என்னன்னா, he wanted to share his father's journey with everyone so that just to create the awareness so that another person should not suffer from this. இதுதான் அவரோட ஒரே motive. So today we have him as the next speaker. So அவரை பற்றி ஒரு small brief introduction. அவர் யாருன்னு let us know. So he brings in 21 years of corporate experience in consulting, sales, client management and training. So நிறைய interests இருக்கு அவருக்கு. He is an avid learner, he is a writer, he is a traveler and health and fitness lover. He runs marathons, he is an endurance cyclist, he cares for the environment and he contributes to the community initiatives by of course creating awareness on health and fitness. So he has been leading a squad of visually impaired girls in India's largest women's run for the last 5 years. His fitness journey and how he got inspired from his father. இது வந்து recently it was broadcasted. எதுலனா All India Radio under Fit India New India series on February 25, 2020. So last year 2019 Suresh sir வந்து he has run 2 world major marathons, Chicago Marathon and New York Marathon, that was scheduled in just 2 weeks between each other. We can understand. Now he ran both the prestigious marathons and he dedicated it to his father, right? And he also raised funds and exceeded the fundraising target from 3694 USD rupees 2,60,000 yarukana children's cancer research and cure idukku. The larger objective, so மெயினா இந்த டிரைவ் இவ்வளோ பண்ணணும் அப்படிங்கிறதுக்கு பின்னாடி ஆதாரமாக இருந்தது என்னென்னா அவரோட அப்பாவோட மெசேஜ் ஆஃப் எக்ஸசைஸ் அண்ட் த்ரூ அ ரெகுலர் எக்ஸசைஸ் ரெஜிமென். இப்போ சொன்னாங்க நம்மளோட 2 டாக்டர்ஸும் எக்ஸசைஸ் எவ்வளோ இம்பார்ட்டண்ட், அது நம்ம கரெக்டான டயத்துக்கு பண்ணோம்னா we won't be needing so much of invasive procedures. So that is what it is. So through a regular exercise regimen one can lead a strong and fulfilling life. As நம்ம எல்லாருக்குமே தெரியும் what is life, it's just to keep ourselves happy. If we are happy, people around us are happy, and this is his father's perspective and he wants that to be shared to all of you all, right? So please stay in and hear our next
to all the members there, and namaskaram. Thank you, ma'am, for this introduction, and it's an honor and a privilege to be part of the IP's Indian Prostate Cancer Foundation support group, and to get this opportunity to share the experience of my dearest father, Mr. Desikachari Srinivasan, who fought. He's a double cancer survivor. He fought bladder cancer, the bladder CA, and he fought prostate cancer in the later part of the years. So I will briefly be touching upon his indomitable spirit and his willpower to live life and face both these cancers with a lot of courage, positivity, and through faith healing. And this is basically going to be the main focus of the session today. That's power of positivity and faith healing. I first of all, I have tremendous respect to all the members. I was able to hear all of you sharing your experience. It is I have just been on the other side. I'm a caregiver. I'm a devoted son to my father. Shall always remain. But I've seen my father, going through a lot of this extreme battle of coping with a lot of courage. It's not easy. I can every situation I know it's different. It's not at all in an easy battle. It's really a battle of the mind, and caregivers who I believe are also part of this support group, created by the Indian Prostate Cancer Foundation, the Curie Hospital. It's a wonderful initiative to get all the people together and have a community. Very, very essential. So I'll quickly start. Am I audible to everybody? So I just, maybe Rama ma'am can just let me know that I'm audible.
You're audible, sir, but your face is not seen.
Okay, I don't know are you able to see the slides? The slides are audible, right?
Slides are seen, sir, yes.
Okay, I don't, okay, is it, or are you able to see me now, or no, even now is not able to see me?
No, sir, you're not able to see.
I don't know. Okay, is it better now? Okay, I think when you show the slides in the slideshow mode, it's maybe you're not able to see me. One second, maybe let me. Okay, is it am I visible now? No. Am I visible now? No. Okay. So, but are you able to see the slides? Because this is not in the slideshow mode. If you're able to see me and the slides, then I'm fine.
Yes, sir.
Okay. Perfect. So I just gave a background of the topic now. So I'm also conscious of your time and the time allocated to me, which is 15 minutes. So So I will be actually quickly jumping on to the topic. So as introduced by the speaker, that this session is a brief experience sharing session, is about my father, my dearest father. How he coped and fought the battle with positivity, dealing through faith healing. And yes, I'm going to briefly touch upon the nutrition and the other factors which play a very, very essential role in fighting stress, anxiety, and fighting negativity, more importantly. So uh, first of all, a few disclaimers I would like to make through this slide. I'm not a nutritionist, not a doctor, but this purely this all that information that I'm presenting to you is purely based on my experience of the last of more than 2 decades. Uh, so I'm going to just so my father, I lost my father in 2018, February 28. So it's actually an honor to be actually talking about him. It is going to be this 28 is going to be the fourth anniversary since the time I lost my dad. And I just want to play this video. And this is a very remarkable and a very profound message which my father left while exercising in a neighborhood park. And I would like to play this to you all so that you could hear him speaking. Okay, so I hope you were able all. I hope you all were able to hear the message and the video. I hope this was audible. I just wanted to hear. Was it audible, Rama, to the audience? Perfect. Perfect. Glad to know. Glad to hear that. Glad to hear that response. So now, 2001, my dad, actually, I will sort of go back to this slide and then come back. What is faith healing? So 2001, as my dad was mentioning in the video, he was diagnosed with CA bladder, right? After biopsy was done. He saw it through. He faced a lot of medical situations and surgeries. He had a couple of surgeries. And then finally, in 2007, he was diagnosed with prostate cancer. Now, in this entire journey, he had to go through. I mean, we were lucky. We were very grateful to have had an early intervention for him, because he was detected, and this was detected as stage 1, both for the bladder CA as well as for the prostate. So, and we were also under the medical guidance of a very eminent and well-known urologist, Dr. N.K. Mohanty, who was then the head of the department at Safdarjung Hospital, which also came to us through a reference of somebody we knew at ICMR in New Delhi. So we were grateful that, so getting into the right hands of a well-known urologist is very important. So that happened. And but then, since it was the first time my dad was going through all this, so there was a lot of changes he was going through in his body, right? The series of treatment involved surgery. It was chemotherapy to contain the cancer. Then immunotherapy was also later on. We had also followed as per the advice of the doctor, we went through immunotherapy treatment as well, and then finally radiotherapy. Now, all this meant that there was extreme weakness, and obviously there were a lot of medication that he was going through. Right? For example, he started with Biora. I don't know that medication. Of course, it's everybody goes through a different medication, but 2012 treatment till 2012, he was managed through medically through Biora 50 mg. Now, one more thing which I wanted to mention, and I'll go back to the faith healing, is that he had doctor told him that you have to go through orchectomy, right? So my dad had full faith in the doctor. So he said, okay, whatever you suggest and recommend, I'm all for it. So he got the orchectomy procedure done. And even I'll still remember while his surgery was done, there was a sort of a emergency in the hospital. Somehow the stitches were not done properly, and he was bleeding. I still remember that incident very, vividly. The blood started oozing, and suddenly, I was there around him as an attendant, and I could actually call the doctor, and we could actually diffuse the situation. So I just wanted to say that all this was not possible without a strong belief system that my dad believed in. He believed in his prayers. He used to, he used to regularly go to the temple. He was a very strong-willed person and very independent. He used to drive himself, to work. And I'm very happy to share with you all that my father actually worked till the time he went into hospitalization at the age of 79 years and 11 months. So he worked and kept himself active till that age. So he mentally kept himself engaged and positive, and I was very regular with his exercises. Whatever be the situation, whether it's raining or something, he will always go and step out for his walk and for his exercise. And obviously the kind of medicines that he was consuming, it had a lot of side effects. It started later on, it also started affecting his heart. It started affecting his kidneys. So faith healing, so my father spent, this photograph is basically of Govind Sadan. This is a place which believes in interfaith. So interfaith is basically all religion. They practice and worship all religion under one place, and they believe that God is one. And my father used to frequent this place along with my mom and myself, and whatever spiritual hukam we used to get, hukam as in the order, we used to do that. For example, as he was mentioning, in 2016, he was advised by the oncologist to go through radiation therapy. So when he started with radiation therapy, somehow it had a side effect, and he started bleeding from his rectum quite repeatedly, not once. And every time the bleeding had to be stopped, had to be contained by a procedure called colonoscopy. And we were told that this happens in few cases, not all cases, and therefore that procedure of, so one, he was anyway dealing with prostate cancer, and over and above the side effects that came through radiation therapy. So it was very tough. So he used to bleed quite frequently, and his hemoglobin used to drop. So many times, there were times when we had to be transfused with, blood. Blood transfusion had to be given to bring his hemoglobin up to the required level. So, so this came as an additional challenge, and we prayed. We prayed to at Gobind Southern, and and suddenly we saw that this bleeding stopped for some time. Yeah, and I mean, there was a relief, of course, but then after some time it started coming again. So with all, every time the colonoscopy itself is a very painful procedure, and so my dad was so independent that he would drive himself to the hospital, and he would pick me up from from the office, and he says, you don't need to come and waste your one office day. I will get it done myself, and I will pick you up. So he was very, very strong-willed person. So I just wanted to give that background of the challenges that he faced in the later part of his prostate cancer journey. So early intervention, I spoke. Faith. Now, faith builds a strong belief in yourself, belief in your community, belief around in your people, belief to be able to fight with confidence, right? The situation that you are in, and yes, it also, my dad was, anyway, from the very beginning, he has faced a lot of situations, a lot of challenges in his life. He was fearless, come what may. He always used to say one thing: if it has come, so we will fight it. So he was very positive in his mind, and so he was fearless, and he fought with a lot of confidence, coming through the energy that he got through faith healing. So, so that helped him to cope with courage. Yeah, he used to. I definitely want to mention that how he used to mentally keep himself engaged is obviously his work kept him busy. He was even though he got retired at the age of 60, but he still was a consultant to few companies, and he channelized his energy in a very productive way, in a very positive way. And he was fond of music. He was fond of Carnatic music. He was fond of attending kacheri, and he was fond of attending going to temples and attending all functions. So he would go independently. He was very independent, and he used to love going out for his exercise in the morning. So it's very important to have that sort of community support. At that time, we did not have that community support. Yes, we got in touch with one or two people in the hospital who were also facing similar yet different situations, because I think prostate cancer, the treatments can be different, right? Not everyone has to go through orectomy. Some will go through prostatectomy. So it totally depends. So community support definitely, like the one we have in the country through IPCF, is a great platform to come out and share concerns and seek answers. All this helped my dad battle a lot of emotional upheavals, and he kept himself calm and managed his stress levels. So, so I would also like to sort of bring here the role of survivor and the caregivers. I think caregivers also go through an emotional upheaval, because it's difficult for them to see their loved ones going through this battle. It's not easy, and it definitely has a huge impact on their own life, right? The question is, how do you actually again go back to what my dad did, was channelize your mind. So there will be a lot of emotions, negativity, but then with every negative thought, you have to counter that with a positive thought and positive energy. So idea is to, you know, best way that I did was to form good habits. Yeah, build new habits, stick to them, follow a holistic health. It always helps. Holistic health means you focus on good eating habits, sleep hygiene is very important. Help Helping others. Sometimes when it's good to forget your sufferings and your pain and start helping others, because then you start doing that, it also, it makes you feel better. Hope is very important. I think all you see is all H here. Hope, never give up hope, right? Come what may. My dad was very strong believer of this. He never gave up in his life, and he had a tremendous willpower to live, and his indomitable spirit to fight, come what may, whatever the situation. I think he was very brave, very bold, and that is the reason he lived for 17 years after detecting with his bladder CA in 2001. When he was detected in 2001 CA, he accompanied me for a road trip from Delhi to Ladakh, knowing that I'm going alone, because he wanted to bond with me. So I think it's important that you build that bond with your family, and never lose that opportunity to build that bond. It's very important. Be honest about your feelings. It's very important. If you feel you should reach out to people, do reach out. Nowadays there is a lot of help available. Healing is a process. Do whatever. I think everyone does it. Everyone has his own way of healing with people. Some get healed through their family support system. Some get healed through a strong faith and belief in God. And I think that is very good if you can actually have a strong belief system. Healing is very important, because when you're dealing with such tough situation in your life, you become, to get that inner strength in you is very important. That inner strength is not your physical strength, but it's your mental and inner power to deal with with a very big challenge like cancer, with a lot of courage and hope. Happy. Now, yes, there were stress times. There were very stressful times. Like I said, he went through multiple surgeries, multiple medical situations. He was always very independent, though we were always there with him, but he always kept himself calm and collected, and he always looked at ways by engaging himself how he could keep himself happy. And exercise, he mentions, that is one of the very good ways to keep your self happy. And hobbies, anything. If it's music, you could develop anything that makes you happy. Yes, I think it's very important. Sometimes we get stressed, we get a lot of anxious, and it is obviously a very obvious situation to feel stress and anxious, especially in the early part of your journey. But it's very important to also focus on exercise, nutrition, and sleep. Now, I would also say that as a caregiver, uh, the PC runs in your family history, in your genetics. My father's father, that is my grandfather, also had it in late 90s. Now, it's important to also resort to preventive measures for caregivers also, by resorting to a holistic health approach in the form of good exercise program, good nutrition, and good sleep. Now there are certain nutrition and diet, if you follow, research has medical research says, medical science and research says that you can't eliminate but you can prevent it. Like for example, if you reduce the amount of calcium to less than 1200 mg, or take a lot of fiber. It's very important to take a lot of fiber, at least 30 mg in a day. Fiber, you can get it from whole grains, green leafy vegetables, and it's important to take anti-inflammatory foods as well. I'm going to talk about them very briefly in my subsequent slides. Now, so what can I do? What can be done to manage stress? So there are various ways. Everyone, I mean, this is just this is not an exhaustive list. There could be more than what is mentioned in the slide, but you could do whatever makes you feel calm. For example, deep breathing exercises like yoga, meditation can definitely make you calm. And it's always good to do it in a collective way. Do it in a group. It even gives you more healing energy. Regular exercises, important. We've talked about that. We talked about the importance of that. Hydration and minimizing caffeine consumption. I mean, coffee, tea is very good, but only to a certain extent. In fact, green tea is known to prevent prostate cancer, and coffee is also good, but only in moderation. Limit yourself, limit your alcohol intake. It's very important. Spend time with nature. I think nature has got such an amazing healing power, and the more you connect with nature and spend time in nature, it really makes you feel good. And make relationships, grow your personal relationships with people around, and minimize technology usage, and exercise and eat alone. And I think one of the most important thing my dad always told me, you must laugh and laugh more. So whatever be the situation, smile keeps you, because the positive energy, there's a saying, the positive energy begets positive energy. It's a multiplying factor. Surround yourself with people who keep you happy and positive always. Now, these are some of the hormones that we all know that can help us to beat the stress. Some people, some people have pets in their home. Some people have small babies in their home. They play. So all that gives you, happiness in different ways by releasing different hormones. Like oxytocin is generally called the love hormone. Dopamine is good when you feel very good when you have achieved the task of the day. So it just gives a boost to your brain. Serotonin is taking enough sunlight, taking a walk in the nature or in the park. These are all great ways to release, by doing certain activities. It helps us to release certain happy hormones. Yeah, and this is what I would say, that connect with nature, go for nature walks, maybe 15 minutes in a day, maybe 20 minutes a day. But that time, you feel so connected with your own self and with nature, and you feel very calm and feel very relaxed with all the worries. I mean, you can actually, worries will always be there, but when you go out in the nature, you'll feel that you left your worries at home. When my father used to be in the hospital, I never left my running. I always used to step out for a half an hour or 45 minutes, because it helped. It recharged me. It made me forget the current problem for that moment. So please resort to please spend time in the nature. It will really make you feel better. Nutrition is very important, and we've talked about it. There was a study which was done recently that eating certain brain foods can actually be good for your brain, and that can actually help you fight depression. I mean, we obviously the situation that my dad was in, or anybody who is in a similar situation, will face stress, will face various kinds of stress, emotional stress, lot of stress, and it affects. It makes you more, anxious, and it can also you can also go in depression. The idea is not to keep stress at minimum level, because as it is, you're going through a lot of medical battle in the form of medications and lot many things. The body is going through many changes. So keeping less stress or tackling stress, we can't completely eliminate stress, but we can definitely control it to a certain level, and taking good food and having a positive mindset and clear thinking will definitely help us to train a mind in a much better way. So, yeah, so some of the foods that I talked about was, it's very important to take these foods like cruciferous vegetables like broccoli and cauliflower. They're again known to prevent prostate cancer. There is a study that has been done on that. And a lot of people also, I mean, it has also been mentioned that cooked tomatoes in olive oil also helps to prevent PC. So even if you have it, still you can take these diets. Oats is good. Uh, yeah, strive towards a balanced diet, avoid fats, and keep your dairy foods. They say generally it's said that keep your dairy foods to minimize your dairy intake, and it is best not to take red meat if possible, or it's better to avoid take vegetarian diet. uh, we've talked about all this. Clear thinking keeps us sane and positive, improves cognitive and decision making, and most importantly, it helps us to lead a better life in whatever state we are in. So So I have just two slides left, and I'll be happy to take the questions. I think we've already gone. I've taken, I think, about 20 minutes, right? I think I'll just wrap it up in another 2 minutes, and then I can. I'm happy to take up any questions if the audience has. So other factors to cultivate positive energies could be, don't think of big changes, make small steps, and be soft on yourself. Don't be hard on yourself. It's very important. I mean, whether it's your I'm equally, I'm also looking at from a caregiver point of view, because I can understand what a caregiver also goes through in the journey. Make time for yourself, very important. Make time for your family and friends. Never lose an opportunity if you have it today. Make time for your hobbies. Be part of support group community like the one we have. We're very grateful to IPCF. Be kind, compassionate, and empathetic. Be helpful to others. Smile more. Practice mindfulness through meditation, yoga, and minimize the use of technology. And I would say maintain a gratitude journal. This gratitude journal has really helped me to cope with my father's loss in 2018. And also, I recently, a year back, I lost my mother due to COVID second wave. So life has been, hard on me, but you can't help it. This is hard. This is life. You have to face it. You have to stand up and face. So I practice writing down my thoughts by maintaining a gratitude journal. Most importantly, whether it's caregivers uh, or the survivors, uh, please go for periodic health checkups from time to time as advised by your doctor. And I think uh, as we all go past 40, it's very important for us to also as caregivers also to go for periodic or annual PSA checks. uh, and finally, my final thoughts before I end and leave it for you, leave the, invite questions from the audience. I said, we spend time with nature, spend quality time with yourself, maintain a gratitude practice, mindfulness, invest in yourself through exercise and eat well. Focus on building willpower. There are exercises, there are, that you can work on building willpower, very important. Invest in sleep to minimize stress and maintain good health, and live life. Live life. And finally, I would say, present moment is precious. So let's take control and embrace everything that would make us happy. Thank you for your patience, time, and interaction. Now, I'm happy to take if there are any questions, or else I will hand it over to Rama.
Thank you, sir. Thank you so much for the wonderful session. Thanks a lot for sharing your father's experience and your exploring things on diet and fitness. Thank you so much. Any questions?